Good evening, everyone. Welcome to LUM CAA assessment for CAA aspirants. Anatomy and physiology module. We are now going to take up musculoskeletal system part 1 and the Yuan-Source points. Let's start polling. Can you please mute your mic? Okay, mga questions yung mamaya na lang ha. We're running out of time. Let's call on Ma'am Angel. Are you ready?
Yes, Doc. Good evening, Doc. Good evening,
Good
classmates.
evening. So let's start. Okay. We are going to discuss the muscles of the whole body front view. Which muscle is number 10?
Number 10, the brachioradialis po.
The vastus medialis is indicated by number what?
Number 14.
Which number indicates a sternocleidomastoid?
Number 4.
The tibialis anterior is indicated by number?
Number 15 po.
Which muscle is the trapezius?
Number 5.
Number 6 is pointing to what?
Pointing to the deltoid po.
Which muscle is number 3?
The orbicularis or oris.
Number 9 indicates what muscle?
The external oblique.
Which number indicates the vastus lateralis?
Number 13.
Number 12 is pointing to?
The
Iliopsoas. Okay, good. Number 8 indicates?
Number 8 indicates the bicep brachii.
Biceps brachii.
Brachii, sorry.
Which muscle is the rectus abdominis?
Number 11.
The pectoralis major is indicated by number what?
Number 7 po.
Which muscle is number 1?
The frontalis po.
Number 2 indicates what?
The orbicularis oculi.
Number 2 is pointing to what muscle?
The masseter.
Number 10 is pointing to what?
The adductor longus.
Wow. Vastus intermedius is indicated by number what?
Number 12.
The temporalis is indicated by number what?
Number 1. Number 1 po.
Which number indicates the tensor fascia latae?
Number 6 po.
Which muscle is the transversus abdominis?
Number 5 po, Doc.
Which muscle is number 13?
The gastrocnemius.
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 Which muscle is the serratus anterior?
Number 4 po.
Which number indicates the soleus?
Number 15 po.
Which number indicates the zygomaticus?
Number 7 po.
Number 11 is pointing to?
The sartorius.
Number 3 indicates?
The scaleness.
The scalenes.
The scalenes. Scalenes.
Scalenes, okay. Number 9 indicates?
The pectineus.
Which muscle is number 14?
Number 14 is the perennius longus.
Which muscle is number 6?
Number 6, the bicep femoris.
Which muscle is the semitendinosus?
Number 4 po, Doc.
Which muscle is number 7?
Number 7 is the
Gastrocnemius.
Gastrocnemius.
Okay. Which muscle is the triceps brachii?
Number 2 po.
Which number indicates the soleus?
The soleus po is number 8.
The semimembranosus is indicated by number what?
Number 5 po, Doc.
Number 10 is pointing to what?
The deltoid.
Which muscle is number 15?
Number 15, the gracilis.
The trapezius is indicated by number what?
Number 9 po.
Number 14 indicates what?
The gluteus medius.
Number 11 is pointing to?
The infraspinatus.
Infraspinatus, okay. Number 3 is pointing to?
Number 3 is pointing to the gluteus maximus.
Number 13 indicates?
The flexor carpi ulnaris.
Yeah, flexor carpi ulnaris. Which number indicates the occipitalis?
Number 1 po.
Which muscle is the latissimus dorsi?
Number 12 po, Doc.
Wow, congratulations. Kailan ka pa magkakamali? Okay.
Thank
Did
you
you
po,
all
Doc.
get this from the ebooks?
Yes po, Doc.
Helpful po.
And also the
Congratulations,
internet po.
Ma'am Angel. Alam mo,
Thank you po, Doc.
I'm proud of all of you. And so I hope walang magkakamali, bawal pong magkakamali, okay? You have no reason to give a wrong answer. Next, we call on Sir Darwin Misola,
Yes, sir. Doc.
muscles of whole body side view. Which muscle is number 10?
Frontalis.
Wow.
Frontalis.
Frontalis is indicated by number what?
1,
Which
1,
number indicates a sternocleidomastoid?
2,
Number 3 indicates which muscle?
3. Deltoid.
Which muscle is number 12?
Biceps brachii.
Yeah, biceps brachii.
Brachii.
Number 13 indicates which muscle?
Rectus abdominis.
The gluteus maximus is indicated by number what?
7,
Which number indicates the gastrocnemius?
15.
Which muscle is number 11?
Pectoralis major.
Number 9 indicates which muscle?
Tibialis anterior.
The latissimus dorsi is indicated by number what?
4,
Which number indicates the sartorius?
14.
Which muscle is number 8?
Vastus lateralis.
Number 5 indicates which muscle?
Brachioradialis.
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 Okay, very good. Extensor digitorum is indicated by number what?
Number 6.
Which number indicates the occiput?
1.
Which muscle is number 10?
Orbicularis oris.
Number 14 indicates which muscle?
Vastus medialis.
Which muscle is number 12?
External oblique.
Number 2 indicates which muscle?
Trapezius.
Which number indicates the serratus anterior?
4.
Number 6 indicates which muscle?
Gluteus medius.
The iliotibial tract is indicated by number what?
7.
Which label indicates the adductor longus?
13.
The triceps brachii is indicated by number what?
3.
Which muscle is number 9?
Orbicularis oculi.
The biceps femoris is indicated by number what?
15.
Which muscle is number 8?
Soleus.
Which number indicates the extensor carpi ulnaris?
5.
Number 11 indicates which muscle?
Palmaris longus.
Number 9 indicates what?
Frontalis.
What does number 15 indicate?
Orbicularis oris.
Which number indicates the buccinator?
6.
The zygomaticus major is number what?
13.
The procerus is indicated by number what?
10.
What does number 2 indicate?
Temporalis.
Number 11 indicates what?
Orbicularis oculi.
Muscle number 1 is?
Galea neurotica.
Okay, that's the third layer of the scalp. Okay. The mentalis is number what?
7.
Which number indicates the corrugator supercilii?
3.
Good. Which number indicates the risorius?
14.
Muscle number 8 is?
Sternocleidomastoid.
The masseter is indicated by number what?
5.
The nasalis is number?
4.
The zygomaticus minor is indicated by number?
12.
Okay. Congratulations. Hindi ka talaga nagkamali. Wow. So I'm so proud of you, the two of you. So bawal magkamali ah. So in case you're not sure of your answer, you still have time to correct them. Congratulations, Sir Darwin. Wow. Really, really makes me feel so good. Okay. Okay. So, at least madali ah. Next, let's call on Sir Elvis Blones, who looks very prepared. Let's go.
Good evening, Doc.
Good evening. What does number 1 indicate?
The orbicularis oculi palpebral part.
Okay. Number 11 indicates what?
The dilator naris.
Okay. Zygomaticus minor is number what?
Number 10.
Okay. Muscle number 4 is?
the levator anguli oris.
Which number indicates the temporoparaetalis?
Number 8,
Number 9 indicates what?
the orbicularis oculi orbital part.
What does number 5 indicate?
Number 5 is depressor septinaci.
Number 2 indicates what?
Number 2, the levator labii superiores
Alec- Alecanesi. Okay, very good. The sternohyomastoid is indicated by number what?
Number 7,
The depressor labii inferioris is indicated by number what?
and number 6, the
Muscle number 15 is what?
number 15 is the omohyoid.
The platysma insertion only is number what?
Number 13,
What does number 3 indicate?
number 3, the levator labii superioris.
Muscle number 14 is
Number 14, the depressor anguli oris.
which number indicates the risorius?
Number 12,
Number 1 is pointing to what?
number 1 is epicranial aponeurosis.
The trapezius is indicated by number what?
Number 7,
Number 11 is pointing to what?
orbicularis oris.
Number 8 is pointing to what?
Number 8 is the frontalis.
The orbicularis oculi is indicated by number.
Number 9,
Number 9 is pointing to.
the orbicularis oculi.
Okay, temporalis is indicated by number.
This number 2.
Number 6 is pointing to.
Number 6 is levator scapulae.
Okay. Orbicularis oris is indicated by number.
Number 11,
Sternocleidomastoid is indicated by number.
number 4,
The platysma is indicated by number.
13,
Number 3 is pointing to.
occipitalis.
Number 10 is pointing to.
Number 10 is the masseter.
The splenius capitis is indicated by number.
Number 5,
Number 12 is pointing to.
the mentalis.
The orbicularis oris is indicated by number.
Number 11,
Number 7 is pointing to.
trapezius.
Number 9 is pointing to.
Orbicularis oculi.
The orbicularis oculi is indicated by number.
Number 9,
Number 2 is pointing to.
the temporalis.
The frontalis is indicated by number.
Frontalis number 8.
Number 11 is pointing to.
11, orbicularis oris.
The occipitalis is indicated by number.
Number 3,
The epicranial aponeurosis is indicated by number.
number 1,
Number 13 is pointing to.
platysma.
The levator scapulae is indicated by number.
Number 6,
The mentalis is indicated by number.
number 12,
Number 5 is pointing to.
splenius capitis.
The masseter is indicated by number.
Number 10,
Number 4 is pointing to.
number 4 is the sternocleidomastoid.
Okay, congratulations. Pwede na kayo magtayo ng perfect, club perfect. Okay, sinong gustong sumali pa? Bawal magkamali so I'm so proud of you, the three of you so far. Let's call on June Azariel. Good evening. Bawal magkamali Okay, go.
Kinakabahan ako, Dok.
The orbicularis oris is indicated by number.
11,
Number 13 is pointing to.
platysma.
The mentalis is indicated by number.
12,
Wow. Number 4 is pointing to.
number 4.
No, number 4 is pointing to.
Sorry. Wait. Levator scapulae. Sorry, Doc.
Number 4. Would you like to change your answer?
Sternocleidomastoid.
Sternocleidomastoid. So you owe us, sir, may penalty, ha?
Opo, Doc.
Okay. Sir Albert, please take note. May penalty. Ano ba yan? Huwag kayong, it's
Noted, Doc.
bawal na
Noted.
kabahan, ha? Remember, may practical exam pa kayo with Dr. Webb on February 15. So that's where we really would know kung talaga marunong tayo. Okay. The levator scapulae is indicated by number?
Number 4. Number 6, Doc.
2 mistakes. Number 7 is pointing to?
Trapezius.
Epicranial aponeurosis is indicated by number?
6.
Ano? Epicranial aponeurosis. What is your answer?
Number 1, Doc. Sorry.
Okay. 3 mistakes. Bawal magkamali, ah. You have to get used to this. The number 8 is pointing to?
Frontalis.
Temporalis is indicated by number?
2.
Number 10 is pointing to?
Masseter.
The splenius capitis is indicated by number?
1.
No. So kung mali ang number 1, ano ang number 1?
Epicranial aponeurosis.
So why did you answer splenius capitis?
Sorry, Doc.
So what is your answer?
Epicranial aponeurosis.
No, splenius capitis ang tanong. Anong number yan dyan?
Number 1 po.
No. Yan ba yung splenius capitis? Kasasabi mo lang, iba yung... Are you, don't be nervous. Okay, splenius capitis is indicated by number 1. Kasi sabi mo number 1 is epicranial aponeurosis.
11 is
Galea aponeurotic. Anong number? Okay, ano ang splenius capitis? Anong number?
wait, Doc.
Di ka ba nakinig kanina?
Sorry, Doc.
That's an old question. You know, this is what I want all of you to, kailangan pag nag-aaral tayo pumapasok ka agad. Paulit-ulit, di ba? Okay, so what's your answer here? Nasaan dito ang splenius capitis? Can you show me?
Number 8, Doc.
No. Bakit dumating? Alam mo ba anong ibig sabihin ng capitis? Okay, so the answer is 1. Sorry. The answer is 5. Nandito po si splenius capitis. Okay? Ito naman si levator scapulae. Okay. Don't be, hindi naman ito pagalingan. Yun nga lang, I think you need to exert more effort.
Okay, Doc.
Number 3 is pointing to?
Wait lang, Doc. Occipital.
Number 9 is pointing to?
Oculi. Oculi, Doc.
Orbicularis oculi. Kompleto. The orbicularis oculi is indicated by number what?
Orbicular. Orbicularis. Number 9, Doc.
Okay. Number 11 is pointing to what?
Wait lang, Doc. Wait lang.
Oris.
Wait lang, Doc. Nararatil ako. Wait lang, Doc.
Bakit ka nararata? I presume sinagot mo rin yung first few sets, yung kanina, di ba?
Yes, Doc. Pero
Okay, can you tell me where the frontalis is by pointing on your head?
Pardon. Frontalis.
Nasaan
Number
ang
8 po.
frontalis?
Ito po.
Okay,
Doc.
nasaan
Number
si
8.
orbicularis oculi?
Nandito po sa mata.
So nasaan si orbicularis oris?
Nandito po sa bibig po.
So what's the answer here? Ano yung number 11 dito?
11 po.
Okay, bawal maratot ha. Sige, pagbibigyan ka namin for today.
Okay,
Next, the action of the frontalis is?
Wait lang, Doc.
Did you read the book?
Doc, pero...
What have you been doing since? Wednesday pa yan, di ba? Okay, would you like to, are you going to answer this?
Pass muna ako, Doc.
Oh, okay. Sige. Please exert your effort next time. Let's call naku, paano to? Okay, yung mga hindi ko tinawagan kanina. Oh, let's call on Ma'am Lynn Galarita. Ma'am Lynn, good evening. Can you help out?
Good evening, Doc.
Yes. Good evening.
Good evening, po.
Can you help out? The action of the frontalis is?
Pull the scalp forward.
Very good. The action of the temporalis?
Elevate and retract the mandible.
Yes.
Ito.
Oo, sa location pa lang alam mo na ano function, di ba? The action of the levator scapulae. This is very, very obvious.
Elevate the
Yes.
scapula and help to retract it.
Good. Action of the trapezius.
Pull up the shoulder girdle, adduct, depress, and rotate the scapula.
Okay, good. Action of the masseter.
Close the jaw and clench the teeth.
Okay. So there's a very important point there. Pag nag-aculift ka, alam mo na anong gagawin to locate that point, right? Can you tell us what the point is?
The occipitalis.
No. Acupuncture point.
Wait lang. Sorry, Doc.
Actually, pinapa-clench mo yung teeth niya para ma-locate mo siya. I know you know this.
Okay.
You know
Close
this.
the teeth.
So, pili ka, stomach 2, 3, 4, 5.
Stomach 2.
Okay. I'm sorry? No, not stomach 3. Stomach 3 is no. Yung bang ano, para ma-locate mo yung point na to, you have to ask the patient to clench his teeth. Okay? So, let us know about it next time.
Okay.
Sige, stomach 5. Okay. Stomach 5.
Um,
Which of the following muscles pull the scalp backwards?
the occipitalis.
Good. The action of the sternocleidomastoid is to?
Flex and laterally rotate the cervical spine.
Very good. The action of the mentalis?
Elevate and protrude the lower lip.
Okay. Sa picture pa lang, alam mo na kaagad, di ba? The action of the occipitalis, paulit-ulit.
Pull the scalp backwards.
Okay. Position of the ear is adjusted by what muscle?
Auricularis.
This is a bonus. Action of the orbicularis oculi.
Close the eyelids.
The blank pulls the scalp forwards.
Frontalis.
Good. Action of the splenius capitis is to?
Extend, laterally rotate, and flex the head.
Very good. Action of the orbicularis oris is to?
Close and purse the lips.
Okay. The action of the platysma.
Draw the lower lip interiorly and posteriorly.
Good. The muscle that purses the lips is the what?
Articularis oris.
Good. The action of the rectus capitis anterior is to?
Flex the atlanto-occipital joint.
Okay, so it's so obvious dyan ha, yung green. Yan yung ano, rectus capitis anterior. Action of the zygomaticus major is?
Elevate and draw the angle of the mouth laterally.
Great. The blank closes the eyes.
Orbicularis oculi.
The action of the rectus capitis posterior is to,
extend and rotate the atlanto-occipital joint.
okay, this time i-extend. Okay. Okay. I think it's a given na sa picture pa lang. An important muscle for whistling.
Buccinator,
Okay, buccinator. Very good. The action of the scalenus anterior is to,
rotate the neck and elevate the first rib.
galing. The action of the zygomaticus minor,
Extend and invert the upper lip.
great. Elevate. The corner of the mouth is retracted by,
The razorius.
yeah. Actually, ito yung nagbibigay sa, pag nakaganon yung ano, parang iba, no? Parang demonic yung smile niya, the resorts. Okay, the action of the auricularis is
Adjust the position of the ear.
good. Action of the scalenus posterior.
Elevate the second rib and tilt the neck.
Okay. Action of the risorius.
Retract the angle of the mouth.
Action of the buccinator.
Compresses the cheeks against the teeth.
Okay, for whistling. Okay. Action of the corrugator supercilii.
Wrinkle the forehead.
Action of the orbicularis oculi.
Close the eyelids.
Thank you very much, Ma'am Lynn. Never disappoint. Maraming salamat po. Congratulations. Now let's go to Ma'am Wilma Villarba. Ma'am Wilma, did you study?
Yes,
Okay, very good. So the action of the lateral pterygoid is
depress and protrude the mandible.
very good. Action of the zygomaticus minor.
Elevate and invert the upper lip.
Wow. Action of the superior rectus. Sa mata to ha.
Elevate and to medially rotate the eye.
Wow, nag-aral talaga. Oh my God, I'm so happy. The action of the splenius cervicis is to,
Extend and rotate the cervical spine.
okay, obvious na ha, may cervical spine, cervicis. Action of the obliquus capitis inferior.
Rotate the atlanto-axial joint.
Very good. Action of the obliquus capitis superior.
Extend and flex the head.
Action of the zygomaticus major.
Elevate the angle of the mouth
Laterally.
laterally.
Action of the superior oblique.
Internal rotation and lateral rotation of the eye.
Can you demonstrate to us how this is being done by the superior oblique? I can see your eyes.
Ganun po.
Sige, anyway, sa practical exam na yan ha. Sige. Si Dr. Webb na yan bahala dyan. Okay. Action of the scalenus minimus is,
Elevation of the first and second ribs.
wow, wala pang mali ha. Diyos ko, I'm so happy. Action of the
Opo,
rectus
Lynn.
capitis anterior.
Flex the atlanto-occipital joint.
Good. Action of the rectus capitis lateralis.
Laterally flex the atlanto-occipital joint.
Kasi may lateral, di ba? Okay.
Opo.
By the way, during the practical exam, you'll be asked to demonstrate the movement. Of course. Di ba? I don't know ha. I think that's how Dr. Webb will give the practicum. That's how it should be given. Di ba? Ganun lang yun. Excited? Yes. Okay, go. Action of the scalenus posterior.
Elevate second rib and tilt the neck.
Great. Action of the rectus capitis posterior.
Extend and rotate the atlanto-occipital joint.
Action of the scalenus anterior.
Rotate the neck and elevate the first rib.
Action of the scalenus medius.
Elevate the first rib and rotate the neck.
Great. Now let's go to the origins and insertions. Origin frontalis.
Patay na ako. The skin superior to the supraorbital margin.
Can you tell us the difference between origin and insertion? Sige, next time. Insertion of the masseter.
The zygomatic, ano ba to? Sac and macilia.
No.
Ah,
Ano ba, nakaturo oh.
Saan?
The
Ano ba
angle and ramus of the
pagtitilipan?
mandible. Okay?
Ah.
Next, insertion of the frontalis. Kanina origin, ngayon insertion naman.
The skin superior to the
Okay.
supraorbital margin.
Very good. Origin of the mentalis.
The skin of the chin.
No.
Mentalis.
Origin.
Origin. Ano ba? Hindi ko na makita.
Definitely hindi siya sa skin at the corners of the mouth. The answer is
Okay.
anterior mandible. That's the origin of the mentalis. So kailangan
Okay.
alam natin yung action ng mentalis. Origin of the occipitalis.
The occipital bone and mastoid process of the temporal bone.
Very good. Insertion of the mentalis.
Skin of the chin.
Okay, dito ka nagkamali kanina, di ba?
Opo.
Insertion of the occipitalis.
Occipital bone and mastoid process of the temporal
No.
bone.
No. Tinan mo mabuti yan.
Insertion of the occipital bone.
No. Epicranial aponeurosis. Insertion yan.
Okay. Epicranial.
Origin of the sternocleidomastoid.
Mastoid process of the temporal bone.
Origin.
Origin. Hindi ko na
Sternum
mabasa.
and clavicle. Okay? The answer is sternum and clavicle. Origin of the trapezius.
Spinous process of vertebrae C7,
Up to
T12,
12. And the ligament.
ligamentum.
Okay, very good. Insertion of the temporalis.
Temporal bone.
No. The mandible.
Makita sa
Coronoid process and ramus of the mandible.
mandible.
Insertion of the trapezius. Obvious na obvious.
Spinous process
No.
of vertebrae. Ano sa
Insertion. The clavicle, acromion, and spine of the scapula. Okay.
clavicle?
Origin of the orbicularis oris.
Muscle fiber surrounding the opening
Very
of the
good.
mouth.
Origin of the masseter.
Origin of the muscle opening. Angle ramus of the maxilla.
Ang
Asa na
maxilla.
ba?
Hindi. The zygomatic arch and maxilla. Anong difference ng maxilla sa mandible?
Ang mandible,
Okay, ang
maxilla
maxilla.
dito sa may ngipin. Ito.
Okay, origin of the temporalis.
Temporal bone.
Very good. Insertion of sternocleidomastoid. Kanina origin, ngayon insertion naman.
Sternum and the clavicle.
No, kanina yan. Kanina
Baka
yan.
mali ako ng ano.
Insertion at
Yung kanina,
tayo.
opo. Yung kanina, sagot. Opo.
So
Mali
nasaan?
natin. Nagkabaligtad, Dok, ano?
So mastoid
Ano nga ba
process
yun?
of the temporal bone.
Mastoid.
Okay. Kabaligtad. Magkakamali ka talaga pag mali ka sa origin.
Nagkabaligtad. Opo.
Okay.
Opo.
Next week, we're going to discuss how to differentiate the origin and insertion. For now, memoryan muna tayo. Okay, the last one. The origin of the levator scapulae.
Ano ba ang sagot ko dito? Transverse process of the super 4 to 5 cervical vertebrae.
Okay. Halata, kita nyo yan, Yan. Tapos sinihila siya for. Okay. Insertion of the platysma.
Base of the mandible, the skin of the cheek, and the lower lip of the
And the orbicularis oris.
oris.
Okay. Origin of the orbicularis oculi.
The circular path around the orbit.
No. So paano siya na matatanggal yung mo? Binasa mo ba
makita.
ito sa libro? It should be, it should be sa loob ng orbit.
Okay.
The medial wall of the orbit. Or insertion of the levator scapulae.
Transverse process of the super 4 to 5 cervical vertebrae.
No. Tinan mo ha. Tinan niyo mabuti. Ito po yung insertion. Ano ba ito? Hindi ko naman. Ito po yung insertion. You see that?
Hmm.
Can you see that?
Opo.
Saan siya naka-insert?
Hindi ko na maano.
Hindi
Doon
mo
sa may
makita.
scapula. Doon sa may scapula daw.
Yes. So your answer is
Superior.
wrong. Superior
Opo.
vertebral border of the scapula.
Superior.
Kaya nalilift niya papunta sa origin, di ba? Insertion of the orbicularis oculi.
Circular path around the orbit.
Yeah. So inulit mo lang yung sagot mo kanina, di ba? Ito yung sagot mo sa origin. So
Opo.
tapos ito rin sagot mo sa insertion. Okay, get
Opo.
the point? So dapat magkaiba. Origin of the sternocleidomastoid. This is a repetition.
Opo. Sternum and
Yeah, very
clavicle.
good. Insertion of the orbicularis oris.
Muscle fiber surrounding the opening of the mouth.
No. The skin at the corners of the mouth.
Skin.
Insertion of the sternocleidomastoid.
Sternum and clavicle.
No, sinabi na, no, origin yan, di ba? Origin yan.
Origin.
Sternocleido. Mastoid process of the temporal bone. Tingnan niyo po to.
Mastoid process.
Sige, di bale, ipapakita ni Sir Albert yung mga model doon. Memorize na niya lahat yon. Okay, the origin of the scalenes is...
First and second rib.
No,
Scalene.
dito siya cervical. C2 to
Cervical
C7.
vertebrae.
Yes.
Cervical
C2 to
vertebrae.
C7. Okay. Origin of the splenius capitis.
Nuchal ligament and spinous process.
Yes.
Of C7.
C7 and C7 to T3.
Yes.
The insertion of the scalenes. Yung mga arrow na yan. Nakikita mo?
Scalene.
O, tingnan mo.
Insertion.
Ito, yung parang ito. Yan, pati yan. Ano po
Isa
yan?
na.
Can you see
First
the
and
pointer?
Hindi
First
po.
and second
Second-
rib.
First and second ribs po.
Okay. Insertion of the splenius capitis.
Cervical vertebrae.
No.
Saan? Third.
Dito
Occipital
banda.
bone.
Yeah, occipital bone and the mastoid
Occipital
process
bone.
of the temporal bone. Origin of the buccinator.
Okay.
Yung para makakakaano.
Alveolar process.
Yes, of the maxilla
Alveolar process of the maxilla.
and the pterygomandibular raphe. Okay. The origin of the platysma.
Yata akong sagot dito. Subcu. Base of the mandible.
No. Subcutaneous tissue of the infraclavicular
Tissue
and
of the
supraclavicular region.
Clavicular and supraclavicular region.
Okay, the last one, insertion ng buccinator. Ano yung nakaano dyan? Insertion.
Sir, ano ba to? Yung alveolar?
No, fibers of the
Alveolar
orbicularis.
fibers of the orbicular
Okay.
oris.
So maraming salamat, Ma'am Wilma. So effort pa tayo more, ha? So when we, pagkatapos ng ano natin at 9 o'clock, you should start answering week 3.
Meron na ba?
Meron
Wala
na.
pa yata.
Monday pa. Okay.
ko pa
Okay,
na-open.
maraming salamat. So let's now go to the next one. Let's call on Ma'am SP na mukhang ready.
Sige, pinapabago.
Okay, start tayo. Bawal magkamali.
Yes, Doc. Try ko lang po.
Origin of the splenius capitis.
Luchal ligament and splenius of CB7 and T3.
Okay. Insertion of the scalenes.
First and second ribs.
Wow. Insertion of the zygomaticus minor.
Skin of the upper lip.
Galing. Insertion of the splenius capitis.
Occipital bone and the mastoid process of the temporal bone.
Insertion of zygomaticus major.
Skin at the angle of the mouth and the orbicularis.
Okay, oris. Origin of the corrugator supercilii.
Median and of the superciliary arc of the frontal bone.
Nakatulong ba yung picture?
Yes.
O, diba?
Saka
Ngayon
yung
na-appreciate
bone.
nyo na. Go. Origin of the levator scapulae.
Transverse processes of the superior 4 to 5 cervical vertebrae.
Okay. So, kailangan makapanyo na nasaan yung levator scapulae. Okay? Insertion of the levator scapulae. Kanina origin, ngayon insertion naman. This is a repeat.
Superior, yes. Superior
Yes.
vertebral border of the scapula.
Okay, great. Insertion of the corrugator supercilii.
Forehead skin near the eyebrow.
Origin of the risorius.
The fascia over the parotid gland.
Parotid gland. Origin
Parotid
of the zygomaticus major.
Zygomatic bone.
Very good. Insertion of the risorius.
Skin at the angle of the mouth.
Origin of the zygomaticus minor.
The zygomatic bone.
Origin of the scalenes.
The cervical vertebrae C2 and C7.
C2 to C7. C2 hanggang C7. Lahat yan. 2, 3, 4, 5, 6, 7. Insertion of the scalenes.
First and second ribs.
Okay. Platysma is indicated by number.
1.
Number 2 is pointing to.
Trapezius.
Wow. Number 1 is pointing to.
Platysma.
Internal oblique.
16.
Rectus abdominis.
Number 14.
Transversus abdominis.
Number 15.
Number 3.
The deltoid.
Inguinal ligament.
Number 8.
Number 11.
The sternocleidomastoid.
Number 8.
The inguinal ligament.
External oblique.
Number 7.
Serratus anterior.
Number 6.
Trapezius.
Number 2.
Number 15.
The transversus abdominis.
Pectoralis major.
Number 4.
Number 13.
The biceps brachii.
Number 14.
The rectus abdominis.
Latissimus dorsi.
Number 5.
Number 16.
The internal oblique.
Deltoid.
Number 3.
Number 4.
The pectoralis major.
Sternocleidomastoid.
Number 11.
Number 5.
The latissimus dorsi.
Number 12.
The scalenes.
Scalenes are indicated by number.
Number 12.
Biceps brachii.
Number 13.
Number 7.
External oblique.
Number 2.
The trapezius.
Transversus abdominis.
Number 15.
Abdominis siya na, hindi abdominus. Number 11.
Sternocleidomastoid.
Congratulations, Ma'am SP.
Thank you, Dr.
I'm
Star.
very happy. Wow. Alam ko, alam mo na yan. And so, nakakatulong talaga pag meron tayong background sa massage therapy, no? And also
Yes,
bone
Doc.
therapy.
Anatomy din po, Doc.
Yes. Oh, wow. Congratulations. Sana dumami yung members niyo ng mga perfect. Great. Congratulations. Maraming salamat po. Now let's call on Ma'am Ami Glorioso. Good evening, Ma'am Ami. Are we ready?
Po. Good evening po.
Good evening. Okay, number 30.
The teres major and minor.
Latissimus dorsi.
22.
Number 28.
Number 28 is rhomboid major and minor.
The iliac crest is indicated by number.
24.
Number 29 is pointing to.
Infraspinatus.
Yeah, infraspinatus, sabi ni Google. Pero sige na, Pilipino tayo, infraspina. Number 31.
The serratus posterior.
The deltoid.
Number 20,
Number 33.
thoracolumbar fascia.
Thoracolumbar fascia. Okay.
Fascia.
The trapezius.
Number 19,
Infraspinatus.
number 29,
Number 19.
the trapezius.
Serratus posterior.
Number 31,
Thoracolumbar fascia.
number 33,
Number 20.
the deltoid,
Number 23.
external oblique,
Number 22.
the latissimus dorsi.
Teres major and minor.
Number 30,
Rhomboid major and minor.
number 28,
Number 24.
iliac crest.
Iliac crest.
Iliac crest,
Number 27.
the supraspinatus,
Supraspinatus. Number 26.
the levator scapulae.
Supraspinatus is not what number?
27,
Levator scapulae is indicated by number.
26,
Serratus posterior is indicated by number.
31,
Number 31 is pointing to.
serratus posterior,
Number 20 is pointing to.
the deltoid.
The trapezius is indicated by number.
19,
Number 33 is pointing to.
thoracolumbar fascia,
Fascia. Okay. Number 23 is pointing to.
the external oblique.
The deltoid is indicated by number.
20,
The action of the external oblique is to retract and stabilize the scapula. True or false?
false.
Okay. Which of these muscles flex the elbow joint?
Bicep brachii.
Action of the biceps brachii is to.
Flex the elbow joint and supinate the forearm.
Okay. Can you show us how we supinate the forearm? Ano ba ibig sabihin ng supinate?
Flex ko, Doc, yung brachii.
Ano ba ibig sabihin ng supine? Can you show us? Okay. Kasi baka ano, ewan ko lang kung ako mabibigay ng exam, papakita ko lang yung movement. Sabi mo ano masa. I don't know if ganun yung exam ni ano. Okay. When you supinate, ano ba yung supinate? Ano yung prone? Pronate? Can you show us how to pronate? Yung pala, yung
Mineflex po, Doc, inuuna, paunat.
no. Paano
Paunat.
mag-supinate? Nakahiga yung paano ba tayo nakahiga? Nakatingala o nakadapa?
Nakahiga po.
Okay, so paano nakahiga pag nag-flex ka? So pag ganon, palabas, no? 'Di ba? I-ganon mo yung arm. Okay, that's okay, supinate the forearm. So we will have to go to this point. Action of the diaphragm is to cause inhalation and exhalation. True or false?
True.
Which of these muscles flex the humerus? Ano nagpe-flex sa humerus?
Pectoralis major.
No. Anterior part of the deltoid.
Okay.
Action of the anterior part of the deltoid is?
Flex
Oh, yun na.
and then it rotate the humerus.
Oh, bakit mo to nasagot?
Hindi, nagkaano lang po, nandito lang ako, Doc. Pero tama naman yung sagot ko.
Oh, okay, sige, tama na lang. Okay, the action of the posterior part of the deltoid is to flex the elbow joint. True or false?
False.
Why?
False. Kasi is to the actions.
Okay, outward and backward siya ha, niro-rotate niya yung joint laterally. Okay? Posterior part na yan ng deltoid. Okay? Nasa back siya ng shoulder, ha? Okay? It rotates the joint laterally para ma-move mo yung arm outward and backward. So in fact, we're thinking of doing, what's this? I don't know if you would love the idea of doing shoulder pain lecture para malaman natin kung anong meridian ang involved. Ang dami kasing pasyente may shoulder pain, no? And to be able to understand it, you need to know anatomy talaga. Okay? So habang nag-extension ka, yung posterior deltoid, it will make the humeral head rotate downward and inward in the socket of the... But anyway, it's too much. Ito na, punta na tayo. Which of these muscles abduct the humerus? By the way, paano ang abduction? Can you show us? Are we going... Okay, ano tong ginagawa ko? Ay, sorry. Hindi pala, iba pala yan. Ginaganon.
Abduct.
Okay, itong ganito. Anong opposite ng abduct? Adduct, di ba?
Abduct.
Papunta sa loob. Okay. I would suggest na i-google din yun yung mga ano. So, kasi next week, we'll be focusing more on actions. Okay? So, which of these muscles abduct the humerus? Anong part?
Abduct the humerus po.
Anong muscle?
Trapezius.
No.
Trapezius.
The humerus.
Ano nga doon?
The middle
the-
part of the deltoid. The action of the middle part of the deltoid is?
Abduct the humerus.
Did you get this answer?
Number 9, Doc.
Okay, correct yung answer mo dito? Yeah, number
The
9.
middle part of
So
the
bakit-
deltoid.
Bakit mali ka dito?
Ang number 8, Doc, which of the muscle abduct the humerus is trapezius?
Okay. The action of the middle part of the deltoid is to abduct the humerus. True or false?
True.
Okay. Which of these muscles extend the humerus?
Extend the humerus. Rhomboid major,
No.
posterior part of the deltoid.
Okay, that's your second choice. Correct. The action of the posterior part of the deltoid is to...
Deltoid is to extend and laterally rotate the humerus.
Oh, di ba? Paulit-ulit. One of the actions of the anterior part of the deltoid is to extend the humerus. True or false?
True. One
No.
of the actions of anterior part is to extend the humerus.
Okay, pag inaabot mo yung object, let's say sa shelf, anong ginagamit mo na part ng humerus, ng deltoid? Kasi may iaabot ka sa shelf, may kukunin ka sa shelf mo. So, or sa
Yung ano?
aparatur.
Yung arm po.
So, ine-extend mo yung humerus mo. So, anong part ng deltoid yun? Ano, hindi ka nag-extend ng humerus pala. Hindi yung... Okay, you use the front part of the deltoid para maabot mo siya. No? So, ito yung tumutulong na i-move yung arm mo forward. Okay? That's the anterior, kaya anterior deltoid or the front of the humerus. Anterior part of the deltoid. Okay? So, the answer here is false.
False. Okay.
Which of these muscles cause inhalation and exhalation?
Diaphragm.
One of the actions of the biceps brachii is to flex the elbow joint. True or false?
True.
Okay. Ay, hindi na pala ito sa iyo. Okay.
Hindi na po sa akin. Thank you, Doc.
Sorry po. Congratulations. Medyo mag-umpisa ka na mag-aral tonight, ha?
Yes
Hopefully
po.
matapos tayo ng 9. Okay. Sana po nag-enjoy kayo mag-aral ha. So, sa dami ng mga pictures, imposible. Okay, let's call on Ma'am Lane Arandia. Ma'am Lane, good evening.
Good evening.
Can we proceed?
Oh,
Okay, true or false? The action of the platysma is to compress the abdomen. True or false?
false. False po, Doc.
Okay. Actually, pag yung platysma nag-a-act, yung ano mo, nagkakaroon ka ng slight wrinkling dito sa may skin of the neck in an oblique direction. Okay? So hindi po siya nagko-compress sa abdomen. Which of these muscles flex the vertebrae?
External oblique.
Very good. Action of the diaphragm? Ay, paulit-ulit.
Cause inhalation and exhalation.
Action of the pectoralis major is to adduct and medially rotate the humerus. True or false?
My answer is true.
Good. Which of these muscles laterally rotate the humerus? Lateral, huh? Lateral.
Infraspinatus.
Very good. Actions of the external oblique are to
Compress the abdomen and flex or rotate the spine.
correct. Action of the levator scapulae is to flex the thoracic vertebral column. Sa pangalan pa lang ha, levator scapulae, may idea ka na. So, does it flex the thoracic vertebra?
False.
Very good. Yun na nga, scapula lang, di ba? Ine-elevate. Which of these muscles compress the abdomen?
Internal oblique.
Wow. Action of the infraspinatus.
Laterally rotate the humerus.
Okay. Actually, no, I would like to do, what's this? A webinar, a very short webinar on shoulder pain. Would you like that? Kasi meron tayong rotator cuff injury, so you need to know the muscles that comprise it, no? The seats. Gusto ko kasi lahat ng students, lahat tayo marunong yan. And it really means a lot to the patient, especially if you can really identify the muscles. So that makes us really, really, worth emulating. O, diba? Okay, the actions of the latissimus dorsi are to adduct and medially rotate the humerus.
True.
Good. Which of these muscles adduct and medially rotate the humerus?
Latissimus dorsi.
Good. Actions of the internal oblique are
Compress the abdomen and flex or rotate the spine.
Okay. Actions of the internal oblique is to cause inhalation and exhalation.
False.
Ang inong action to?
Diaphragm.
Which of these muscles elevate and help to retract the scapula?
Levator scapulae.
The action of the infraspinatus is to laterally rotate the humerus.
True.
Good. The action of the latissimus dorsi.
Extend the flex arm and adduct and rotate the humerus.
Which of these muscles adduct and medially rotate the humerus?
Deltoid.
Would you like to have another answer?
Scalines.
No. So pectoralis major. Adduct and medially rotate. Alam ko nakakahilo, pero sige lang. Ngayon nakakahilo. Action of the sternocleidomastoid is to laterally rotate the humerus.
False.
Yeah, because it doesn't involve the humerus. Okay, the action of the levator scapulae is?
Elevate and help to retract the scapula.
Okay. Which of these muscles draw the outer part of the lower lip inferiorly and posteriorly?
Platysma.
Very good. The action of the serratus posterior is to depress the lower ribs, aiding in expiration.
True.
Okay. Action of the pectoralis major is?
Adduct and medially rotate the humerus. Adduct and medially adduct and medially
rotate the humerus. Which of these muscles flex the vertebral column?
Rectus abdominis.
Abdominis. Action of the serratus anterior is to raise the sternum in deep inhalation.
False.
Anong muscle yon? Anong ginagawa niya? Okay. It actually draws the scapula anterolaterally, not the sternum. Okay? It rotates the scapula. The action of the platysma.
Draw the lower lip inferiorly and posteriorly.
Okay, repeat, no? Which of these muscles retract and stabilizes the scapula?
Rhomboid major and minor.
Great. When they work together, the scalenes flex the neck and raise the first rib in strong inhalation. True or false?
True.
The action of the rectus abdominis is to
Flex the vertebral column and compress the abdomen.
alam nyo naman to, kitang-kita, no? Yung tinatawag
Opo.
na. Okay, one of the actions of the rectus abdominis is to flex the vertebral column. True or false?
True.
The action of the rhomboid major and minor is to depress the lower ribs, aiding in expiration.
False.
So what does it do?
Serratus posterior.
Okay, very good. Action of the rhomboid major and minor is to
Wait lang po. Wait lang po. Retract and stabilizes the scapula.
which of these muscles flex and rotate the neck?
Deltoid.
The neck.
Ay, the neck.
Scalenes. Yeah, great.
Scalenes pala.
Diba? Nakita mo yung tatlong scalenes? Okay. Action of the supraspinatus is to initiate abduction at the shoulder joint. True or false?
True.
What's the action of the scalenes?
To raise the first rib and flex or rotate the neck.
Now you know. Which of these muscles protract and rotate the scapula?
Serratus anterior.
The action of the teres major is to flex or rotate the vertebral column. True or false?
False.
Yeah, because it extends, hindi nagfe-flex. And medially rotate the humerus. It doesn't have anything to do with the vertebral column. The action of the serratus anterior is
Protract and rotate the scapula.
which of these muscles depress the lower ribs, aiding in expiration?
Rectus abdominis.
Would you like to
Abdominis.
consider your answer?
I depress. Serratus pala.
Serratus posterior.
Serratus posterior.
The action of the teres minor is to laterally rotate the humerus. True or false?
True.
Okay. The action of the serratus posterior is to
Depress the lower ribs, aiding in expiration.
which of these muscles flex the neck and tilt the head?
Sternocleidomastoid.
The action of the transversus abdominis is to flex the vertebral column. True or false?
False.
Okay. The actions of the sternocleidomastoid are,
Flex the neck and raise the sternum.
kaya tinawag na sternocleidomastoid. Which of these muscles initiate abduction at the shoulder joint?
Supraspinatus.
The action of the upper part of the trapezius is to pull up the shoulder girdle. True or false?
True.
Congratulations po, Ma'am Lane. Thank you for
Thank
being.
you po.
Thank you for. Okay, did the references help? Nakatulong naman, no?
Yes po.
Okay. Maraming salamat po.
Thank you po.
Now we go to Baguio, Ma'am Janine. I know you're very excited. You look quite prepared.
Oh,
The action of the supraspinatus.
initiate abduction at the shoulder joint.
Okay. Great. Which of these muscles extend the humerus?
The posterior part of the deltoid.
Now you know. Which of these muscles adduct, medially rotate, and extend the humerus?
Teres major.
The action of the teres major is
Adduct, medially rotate, and extend the humerus.
rotator cuff muscle includes trapezius, pectoralis major, and the latissimus dorsi.
True.
Okay. Actually, apat yan sila. Can you mention the fourth one?
No, doc.
It's okay. Okay.
Unless it's the deltoid, I'm not sure.
Mm,
No.
yeah.
Hmm?
Which of these muscles laterally rotate the humerus?
Teres minor.
The action of the teres minor is
Laterally rotate the humerus.
good. Action of the subscapularis is to stabilize shoulder joint and medially rotate the humerus. True or false?
True.
Which of these muscles compress the abdomen?
The, uh, the diaphragm.
Compress the abdomen.
External oblique, sorry. Sorry. It's transverse
Transversus
abdomen.
abdominis. That's abdominis.
Abdomen.
Action
Sorry.
of transversus abdominis is. So what is your answer here?
Compress the abdomen. That's true. I didn't go
Okay.
back.
The action of
did
the
not
lower
answer.
part of the trapezius is to depress the scapula.
True.
Which of these muscles pull up the shoulder girdle?
Pectoralis major.
No. Pull up.
Pulls up
Give it
the
another try.
trapezius major.
Upper part of the trapezius.
Yeah, upper part
Action
of
of
the
the upper
trapezius.
part of the trapezius is to. So what was your
Pull
answer?
up the shoulder. Pull up the shoulder girdle. Hindi ko
The
pinabalikan eh.
action of the middle part of the trapezius is to flex the vertebral column. True or false?
False.
It draws the scapula medially. Oo. Sa scapula siya.
Scapula siya.
Which of these muscles cause inhalation and exhalation? Easy.
Correct. Diaphragm.
Which of these muscles laterally rotate the humerus?
Infraspinatus.
The action of the middle part of the trapezius is to.
Retract or adduct the scapula.
Which of these muscles flex the vertebrae?
External oblique.
The action of the lower part of the trapezius is to.
Depress the scapula.
Good. Which of these muscles stabilize the shoulder joint?
Infraspinatus.
Subscapularis.
Okay.
Stabilize the shoulder joint. The action of the upper and lower parts of the trapezius together is to.
Rotate the scapula.
Good. Which of these muscles rotate the scapula?
Upper and lower parts of the trapezius.
Okay. Action of the subscapularis is to.
Stabilize shoulder joint and medially rotate the humerus.
Okay. Which of these muscles depress the scapula?
Lower part of the trapezius.
The rotator cuff muscle includes the.
Biceps brachii and the internal and external obliques.
No.
Uh,
Subscapularis, teres minor, and infraspinatus.
okay.
Which of these muscles retract or adduct the scapula?
Middle part of the trapezius.
The action of the serratus anterior is to raise the sternum in deep inhalation. True or false?
False.
So what does it do?
It raises it's part of the scapula.
Okay, rotates the scapula,
The scapula.
not the sternum.
Yeah,
Which
not
of
the
these
sternum.
muscles compress the abdomen?
Internal oblique.
Very good. The action of the serratus anterior is to.
Protract and rotate the scapula.
Which of these muscles laterally rotate the humerus?
Infraspinatus.
Okay, your favorite, origins and insertions. The origin of the biceps brachii is.
Supraglenoid tubercle and the coracoid process of the scapula.
So it's here, oh. You can see that, right? Here.
Here, yeah.
Yeah, here. Very obvious. The base of the mandible, the skin of the cheek and lower lip, the angle of mouth, and the orbicularis oris are the insertions of what muscle?
The platysma.
Good. Origin of the sternocleidomastoid.
Origin. Okay.
Remember, sternocleido or cleido.
It's from down, di ba, Doc? Manubrium and medial portion of the clavicle.
So hindi niyan sinabi manubrium sterni, no? So yeah, medial part. Very good. Insertion of the biceps brachii is.
Insertion is the radial tuberosity and deep fascia of the forearm.
Very good. Origin of which muscle is described as follows: the lateral border and upper surface of the clavicle, the acromion, and the spine of the scapula.
The deltoid.
Good. Origin of the rectus abdominis is the, can you see it here?
Pubic crest and the pubic symphysis.
Okay, good. Insertion of the rectus abdominis is,
Insertion is the costal cartilage of ribs 5 to 7, xiphoid process of the sternum.
wow, very good. Insertion of which muscle is described as follows: the deltoid tuberosity of the humerus.
The deltoid.
Okay, obvious. Origin of the external oblique.
The posterior, ribs 5 to 7.
Okay,
5 to 12, sorry.
Kitang-kita naman, no? 5 to 12.
5 to
External
12.
occipital protuberance, the nuchal ligament, the medial superior nuchal line, and the spinous processes of vertebrae C7 to T12 are the origins of what?
The trapezius.
Okay. Posterior border of the lateral third of the clavicle, acromion process, and spine of scapula are the insertions of?
The trapezius din ulit ako.
Okay.
Ulit.
Insertion of the pectoralis major is?
Lateral lip of the bicipital groove of the humerus.
So you can see it here. Diba? There.
Insertion.
Bicipital groove of the humerus, the lateral lip. The subcutaneous tissue of the infraclavicular and supraclavicular regions are the origins of?
The platysma.
The insertion of the external oblique is? Here.
The iliac crest, pubic tubercle, and the linea alba.
Good. Anterior surfaces of the clavicle and sternum, the superior 6 costal cartilages, and the aponeurosis of the external oblique muscle are the origins of which muscle?
The pectoralis major.
Congratulations po, Ma'am Janine. And always review your answers. Okay.
I know.
Yeah,
Wise.
I am beginning to feel that you're enjoying anatomy and physiology, no? So we hope the enthusiasm will continue. Okay, as
Thank
we
you.
go. Thank you very much po, and good evening. Let's now call on Ma'am Mary Angeli Templo. Good evening po. Are you there? Ma'am Mary Angeli? Mary
Hi,
Angeli?
Doc. Good evening.
Good
Yes,
evening.
Doc. Good evening.
You're ready, no?
Doc, I know you don't accept apologies, pero ano, Doc, I just came from the wake of my pamangkin, so I wasn't able to reach that far na. Sorry talaga.
Sige, I'm
I
very
don't
sorry.
want to make guesses.
It's okay, I understand. I'm very, very sorry for your loss. Sige po.
Thank you po, Doc.
Okay, let's just make bawi.
I'll try next time po.
Okay.
Yes po.
Okay.
Thank you very much.
Yeah. Okay, let's call on Okay, can I call ba? Oh. Okay, can I call on Ma'am Leia de la Cruz? Ma'am Leia, good evening.
Yes, Doc. Good evening po. Hindi po ako ready, Doc, kasi nung Monday lang po, hindi ako nakastudy.
Okay. Dapat Wednesday pa lang sinasagot nyo na, ha?
Yes po, next time po.
Okay. So let's call on Sir Victor Ginto. Sir Victor, I hope you're ready. Sir Victor Ginto.
Mic test.
Okay, ready yung boses nyo. Can we do this?
Yes, Doc.
Alam ko medyo complex itong ating ano. Anyway, gawin na. I know you can do this. Kasama din po pati yung first 4 questions sa Yuan-Source, no? Okay, I know you can do this. Okay, let's go to question 1. The aponeurosis of the posterior and anterior rectus sheath and the conjoint tendon to the pubic crest and pectineal line form the insertion of which muscle?
The transversus abdominis.
Wow, very good. Insertion of the scalenes is the?
First and second ribs.
Origin of the supraspinatus is the?
Supraspinous fossa of the scapula.
Great. Insertion of the internal oblique is?
Linea alba, pubis, and ribs 10 to 12.
Great. Which muscle has the following origin? The spinous processes of vertebrae T7 to 15, thoracolumbar fascia, iliac crest, inferior 3 or 4 ribs, and inferior angle of scapula.
Latissimus dorsey.
Wow, di binasa talaga. Okay, insertion of the teres major is
Medial lip of the intertubercular sulcus of the humerus.
good. Wala pang mali. Costal margin, lumbar fascia, anterior two-thirds of the iliac crest, and the lateral half of the inguinal ligament form the origin of which muscle?
The transversus abdominis.
Great. Insertion of the levator scapulae is
Superior part of the medial border of the scapula.
okay. Origin of the rhomboids, major and minor, is the
Cervical vertebra. C2 to C.
Tingnan niyo po dito.
Sa rhomboids pala eh.
Rhomboids. Ito yung rhomboid.
Ano?
Hindi ko ma...
Border of the scapula.
No.
Ay, ano?
Can you see,
Major.
anong part po ito ng vertebra? Like, ano ba to? Hindi ko ma...
Sa
Ito.
vertebra. Classic, di ba?
Thoracic vertebra.
Thoracic. Thoracic 2 to 5. Okay?
Okay.
So I hope, okay, at least
sorry,
isa
Doc.
pa lang yung mali. No problem. What is the insertion of the latissimus dorsi?
Yes.
Diyan na, oh. Kita.
Oo. Tama.
Saan siya naka-insert?
Yun sa vertebra.
No. Origin yung banda dyan.
Origin.
Tubercular groove.
Yeah, the humerus, intertubercular groove. Kita nyo to? Bakit hindi ko ito mapo?
Number 10 na pala.
Yes. Origin of the levator scapulae. Oh, repeat to.
The origins posterior tubercles.
Yeah, C1 to C4. Transverse processes. Oh, halatang halata o origin. Great. What is the insertion of the rhomboids, major and minor?
Major
origin, ngayon insertion.
Baliktad na.
Kanina origin, ngayon insertion naman.
So yung border of scapula.
Very good. Great. What is the origin of the scalenes? Paulit-ulit.
Yung ano? Yung cervical vertebra.
Yeah, C2 to C7. What is the insertion of the supraspinatus?
The greater tubercle of the humerus.
Yes. The origin of the teres major is?
Posterior aspect of inferior angle of the scapula.
Great. The origin of the serratus anterior?
Upper 8 ribs.
Great. Middle facet of the greater tuberosity of the humerus and the capsule of the shoulder joint form the insertion of which muscle?
The infraspinatus.
Very good. What is the origin of the quadratus lumborum?
Transverse process of 1 to
Look.
4?
No. Tingnan mo mabuti. Ito banda, oh. Diba ito? Hindi ko maano. Yan. Can you see that?
12th rib?
Yes.
Yun ba yun?
Inferior border of the 12th rib. Insertion of the serratus posterior inferior is? Yan, no?
Posterior aspect of ribs 9
Yes,
to 12.
9 to 12. Origin of the serratus posterior superior is?
C7 to 12.
Okay. C7 to T2.
T2 pa yun.
What is the insertion of the longissimus?
Transverse process has several levels above the origin.
Good. What is the origin of the spinalis?
The spinous process has 6 levels above.
No.
Ay, wait. Dito ko na nilalaman. Teka. Sa sacral and
Yes.
lumbar processes.
Sacral and lumbar spinous processes and supraspinous ligaments. The medial 3/4 of the infraspinous fossa of the scapula and the fibrous intermuscular septa form the origin of which muscle?
The infraspinatus.
Very good. What is the insertion of the serratus anterior?
The inner medial border of the scapula.
What is the origin of the serratus posterior inferior?
The spinous process. And T11 to
Lumbar.
L2.
Yes, very good. Insertion of the quadratus lumborum.
Inferior border of the 12th rib.
No. Insertion
Sa
of
iliac.
iliac crest.
Baliktad din. Kaya iliac.
Iliac crest. Ito, kita nyo to. Ano ba to? Hindi ko yan. Yan. Origin yung kanina, ito naman insertion. Origin of the longissimus.
Transverse processes.
Of the inferior vertebrae. Very good. What is the insertion of the iliocostalis?
The ribs and the cervical transverse processors.
The insertion of the spinalis.
Spinous processes.
Okay. Ito yung insertion. Iba yung origin, di ba? The origin of the iliocostalis.
When drawing.
Kita mo to? This one
ito.
here. Sa baba.
Iliac crest.
Okay. Sacrum and the lumbar.
Sacrum and lumbar vertebrae.
Okay, congratulations po. Hindi pa tayo tapos. Punta na tayo sa Yuan-Source points. Okay. Okay, can you define what Yuan-Source points are?
Yuan-Source are the source of vital energy through which the pathological changes of Zhangfu organs are manifested.
Okay, when do we use it? Like, kailan natin siya gagamitin?
When treating the diseases of internal organs.
Okay, when you have issues. Okay, very good. Kasi nandito yung original chi, yung Yuan chi, di ba? Dito nagsilinger. So, ma-harness mo yung chi doon. Okay. The source points or Yuan-Source points are used particularly to tonify which organs? Yin organs or yang organs?
Yin organs.
Very good. What type of chi is accessed when needling the source points? Kanina lang yan.
The primordial or original chi.
Or Yuan chi. Okay, we have three names, no? Primordial chi, original chi, Yuan chi. Okay, the last one, what are the functions of the Yuan-Source points? On both the yin and the yang channels. Anong functions na sa yin channels?
They treat the diseases of the 5 sang organs. They are used as key point to detect the changes of condition of chi and blood of the 12 regular meridians. They stimulate the vital energy of the regular meridians and regulates the functional activities of the internal organs.
So, anong function niya sa yang channels? Meron ba siyang relevance? Does it have any significant effect on yang channels? Kukunti lang, di ba? Hindi siya nagtotonify. So, kasi nga for yin channels lang siya. Maraming salamat po, Sir Vic.
Okay, thank you.
Very good. So, I know that you know a lot. So, are you enjoying our anatomy class yet?
Very much, Doc.
Salamat.
Mahirap lang.
So, kung ngayon medyo mahaba-haba yung next. So, kayang-kaya pala. No, kayang-kaya. Maraming salamat po, Sir Vic. More power.
Salamat din.
Now, let's call on Ma'am Cheryl Bahamundi. Good evening po.
Good evening, Doc.
So, you will answer questions 5 to 9. Okay, can you tell us ano po yung Yuan-Source ng lung channel?
L9.
Lung 9.
Lung 9.
Okay, for now, yun lang muna ang alamin natin. What about the
Yes.
large intestine?
Large intestine 4,
Very good. What about the stomach?
stomach 42,
Oh, tapusin na natin. Spleen.
spleen 3,
Very good. But the Yuan-Source ng heart,
heart 7,
Yuan-Source ng small intestine.
small intestine 4,
Very good. Yuan-Source of the bladder.
urinary bladder 64,
Very good. And Yuan-Source of the kidney,
kidney 3,
Yuan-Source of the pericardium,
pericardium 7,
Yuan-Source of the sanjiao,
sanjiao 4,
gallbladder Yuan-Source.
gallbladder 40,
Okay. Bonus question. Kasi matatapos na tayo. When do you usually use gallbladder 40? Like for example, like how relevant is it? Di ba may mga tao na very timid, very, hindi makamake ng good decision, major decisions. So these are the people with weak gallbladder chi. So we would use the gallbladder 40. Okay, so para lumakas yung loob and hindi na sila masyadong timid, no? And finally, the last one, the Yuan-Source ng liver.
liver 3.
Okay. So thank you po, everyone. Thank you, Ma'am
Thank
Sherry.
you.
And
Thank you po.
I really appreciate your being so attentive tonight. Do you have any comments? Do you like this kind? Okay, hindi po ako nagagalit kung hindi nyo nasagot, pero I think we need a lot, we need a little stimulation, no? Okay, as I mentioned earlier, it's not possible to be able to just answer all these questions in just one night or 2 nights. Mawawalan po kayo ng tulog. It's going to be boring, no? So I hope everybody will continue the enthusiasm, and ang pinaka-importante dito is when you do the practicum, you need to be able to actually see how these muscles work. So nasa part 1 lang po tayo ng musculoskeletal system. We would like to invite you again next week. And it's good that we were able to finish in before 9 so that you will have time to download the new excuse me.
Torture.
Yes. So medyo nakakaano. I hope you can share the same passion. You need to love what you're doing, no? And this is what will make us more close to our patients, to our clients. So even if some of us did not finish medicine, but if you enroll with us, and thank you pala for enrolling with us, no? And we hope we will meet your expectations. Ang ano ka lang namin is we also want you to really exert more effort. And congratulations to the perfect club. You know who you are, no? And yung iba dyan dapat So the secret here is you have to start opening the notes tonight. Devote at least 2 hours each night because the next one is much longer. Natapos nga natin, no? So we also included the skeletal system, and we're very happy that you all did well. Most of you did well. Okay? So do we have any questions? Do you like this? Okay. Thank you so much for joining. Sandali lang, i-ano ko muna yung